All right, everyone. Thank you for attending the Benton-Franklin Health District meeting. It is February 18th, 2026, and we're going to go ahead and call it to order. Do I have approval for the meeting minutes for January 21st, 2026 for regular board health meeting?
Mr. Chair, I'll move approval of the meeting minutes.
Thank you. We got a motion.
I'll second.
All in favor signify by saying aye.
Aye.
Aye. The motion passes. We'll move on to public comments. Anybody in the room for public comments? Seeing none, we'll go ahead and go online. Is there anyone online that would like to go ahead and speak?
If you'd like to provide a comment, please raise your hand in the Zoom app now, or if you're on a phone, press *9 to raise your hand. I don't believe we have anyone for public comment.
Thank you. All right, we'll close public comments. We'll move on to item number 4, director comments. Anybody there in the room? Nobody. So we'll go on to item number 5, unfinished business. We have none. We'll go ahead and before I move on, I'm going pretty darn quick. I want to go ahead and thank you for all attending. I appreciate it. This is my first time being here as the chair, and I appreciate all of you definitely and all the things you do here for us in both counties. That being said, we'll move on to item 6, new business, and it's resolution 25. Oh, actually, I gotta put on my glasses. I was just told by my county administrator I'm getting old. Resolution 2601 in the matter of support.
Sorry, you gotta
support for continued legislative funding for the essential FPHS system.
Amanda, where are you going?
What are you doing there?
I'm not going anywhere.
And he's awake now.
He is awake. Apologize for that. Printer was not working. Is it my turn?
It is your turn.
Welcome to what public health stands for, being able to bring your baby to work for the first year. He had a cute vest, but we're just gonna ignore that. Okay. What's really great, I'm excited to read this resolution, but we just shortened it just a little bit. Uncle Kyle. It's Mason Mao, our chief morale officer. I love Kyle, don't get me wrong, I do too. But okay, so I've shortened the resolution just a little bit. It's 2 pages and it's pretty lengthy, so we're just gonna get straight to the nitty-gritty. This resolution affirms that a strong governmental public health system is essential to healthy, economically stable communities across Washington. Foundational Public Health Services, known as FPHS, represent the core public health services that must exist in every community to ensure that statewide protection and representation of those core public health services, similar to public safety and infrastructure systems. Now, since codifying FPHS in 2019,
sorry, can I pause? What you're reading does not match what is in the packet. Here, I know we gave you.
You guys told me to shorten it?
Yeah. Oh, I'm so sorry. You sharpened it.
We went ahead and talked about this about 10 minutes
We
ago.
did. I'm up to date now in the middle. Carry on.
Hey, I appreciate the thoroughness. I think that's important. So thank you. You are always welcome to call me out anytime. So what's exciting is FPHS has been around since 2019, House Bill 1947. The legislator has invested in rebuilding and modernizing public health. He agrees, including $300 million in the 2026-2027 biennium. Now, these funds support critical services that we here deliver at Benton-Franklin Health District. It includes detecting and responding to communicable disease outbreaks, addressing environmental health threats, including lead, water quality, foodborne illnesses, monitoring harmful algal blooms, and also school health hazards, coordinating emergency response during incidences like the Lineage Logistics fire in Findlay, strengthening partnerships and community coalitions, and addressing chronic disease, substance abuse, maternal and child health, and mental health challenges, just to name a few. Now, the resolution emphasizes that without stable and ongoing FPHS funding, communities become vulnerable to emerging diseases. environmental threats, wildfire smoke, contaminated water, and other public health emergencies. So whereas the governor has proposed a reduction of $29 million in the 2026 supplemental budget, and whereas supporting core public health services today is critical to keeping communities healthy and strong and resilient to threats and emergencies for our future generations represented here, and public health works in the present so that our future generations will thrive. This I'll read word for word. Now therefore, be it resolved, the Benton-Franklin Health District Board of Health calls on the Washington State Legislature to recognize that public health is essential and maintain foundational public health services funding, and to correct vapor tax errors and the supportive funding dedicated to the foundational public health services account to support core services in all communities and allow public health to continue to rebuild its statewide system and with efficacy. That's your gist of the resolution.
Thank you, man. Any questions or comments? Go ahead, Carol.
I guess what raises the flag and correct vapor tax errors. I have no idea what that is.
Yeah, that's a great question. So, so originally when FPHS was born, it was in part born out of the general fund account for the state, and that's obviously not a great place to be. And so they looked in the last couple of years to where to stabilize funding for the future. And the new vape tax was a way to stabilize FPHS. Evidently, somewhere in the code, deep down, was a vein of advertising costs for vape tax that did not get put into that account. The funding didn't go into the vape tax account, and so it undercut the FPHS money that was being pulled out of it by millions of dollars. And so the legislature, as we understand, has a bill in the House right now to correct that, and hopefully it gets passed by March, which will help that deficit.
Awesome, thank you.
Any other questions? Online, I see none online at this time, so we'll move on to, do I have a motion to approve resolution 2601?
I move to approve resolution number 2601.
Thank you. We have a motion. Do I have a second?
I'll second.
We have a motion and a second. All in favor signify by saying aye.
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 And the motion passes. Thank you. We'll move on to item number 6P, resolution 2602, appointment of interim health officer in times of need. And Janae is going to be presenting on this one.
So we just learned that Dr. Krager would like a much needed vacation. This is his first kind of significant vacation since signing on as our interim. And so in order to help that happen, that means we need to get a backup appointed. And so he actually did go out and find a backup for us, and his name is Dr. Jim Wallace. And he is the current health officer for Okanogan Health Department, as well as Chelan Douglas Health District. And they are very like-minded in their approach. So this would only be used in those times where Dr. Krager is taking a vacation or there are some other adverse event that we could lean on this resolution for Dr. Wallace to be able to take action. With the board's consideration, I'd like to read this. Okay. So whereas Dr. Stephen Krager, current health officer for Benton-Franklin Health District, may be periodically unavailable for a variety of reasons, and it is appropriate for the Board of Health to appoint a position as acting health officer in Dr. Krager's place, as said, during times of absence. Now therefore be it resolved, Jim Wallace, MD, MPH, and current health officer for Okanogan Health Department and Chelan Douglas Health District, has accepted appointment and is hereby recognized as acting health officer for Benton-Franklin Health District during periods of Dr. Krager's absence. Requests for health officer appointment shall be made by the district administrator or in the administrator's absence by the chairman of the Board of Health. Be it further resolved, Dr. Wallace is vested with all rights, powers, and authorities authorized by Washington state law in pursuant to a health officer's duties and responsibilities when requested to act in Dr. Krager's place during times of absence.
Any questions or comments?
Yeah, is there anything that states the duration of an absence before it's no longer considered temporary and it's time to make it, I mean, suppose he's gone 6 months.
Yeah.
Well, yeah, if we were in that kind of a 6 month.
Let's not be, if he's listening, let's not do
So
that.
he's a permanent employee, or he's a full-time employee, so we would be following our leave policies for that. So there would need to be some
That's
sort of
what they're
reason
saying.
for that kind of extended duration. And then all of our leaders are required to send out delegations where there's a start and end time for that leave.
Perfect. That's
Thank
a
you.
great question.
Thank you.
Any other questions, comments?
Yeah, from a payment perspective, how does that work? Do
So-
we compensate the covering health officer, or how does that work?
I don't know that we have in the past, and I don't know that we've actually called upon a backup health officer in the past. But if we did, then yeah, we would look at some sort of compensation arrangement if we needed to call on a decision. Or consulting.
So then that leads into what we would actually compensate. We haven't done that yet.
Yeah.
You guys got any concerns or questions or comments? What would you guys suggest?
Well, again, I think the biggest two things that need to be defined are, the maximum duration per period. Like that's, it's a stretch because like, just give you example of contracts where typically, I'm a medical director, for example, I'm allowed to take some time off, but for example, in my contract, it specifies like if I'm gone, say 3 weeks out of the month, I need first of all approval from the, CEO of that company. And number two, I think I cannot remember exactly the duration, but if it exceeds certain duration, then at that point in time, it becomes essentially a permanent leave, and there's kind of consequences to that in terms of compensation. Like for example, if it's no longer considered a vacation, it's considered essentially a temporary leave, and so that payment is deducted from me so that they can bring somebody to cover. So I think having a little bit of a definition will help. Number one, to ensure that we're not overpaying for services, and number two, to kind of have some understanding what's considered a vacation. So I know you mentioned that it's something in the policy, but I understand also that in the case of physicians, and I speak this as a physician, it may be a little bit different because of the different compensation structure.
Is Brandy here? Brandy, do you mind?
So he's considered a salaried employee, so the compensation structure.
You want to come up front so that we can, that way Dr. Flanders can do. Thank you. You can do this on the fly.
Director Brandy McNeil. So as Dr. Kreger is a salaried hired permanent employee, he would qualify for any other employment contract. There is no separate compensation structure, so he would fall under leave without pay. If we were to go into, or excuse me, not leave without pay, leave policy and programs within that guidelines. So if we were to look at any kind of extended period of time where he would need to be away, and then it would mark into some further contracts or an adjustment with, I'm thinking billing or anything like that, that's when we would start to look at a transition, maybe an interim in that pay, instead of just a fill-in here or there.
Would that trigger it? Let's say it was, if we get within the body of his contract, as an employee, does that trigger a specific, is there something within the body of the contract that would trigger that for us to have to make that decision?
So not within his contract. I think it would go back to our there's Eric, our billing and that kind of thing. So there is some of that sign off and ability to have scope. And so as an employee, if they're filling in as a backup, there is no trigger within that unless there were to be an extended period of time. And so that would meaning exhausted vacation and then qualify under any kind of leaves. That's what would be the HR side of the trigger, I believe. But if it came to any kind of contracts with billing, that would be a different conversation, but we would see it coming and try to plan for that.
So one more question, I apologize. The second question on, I think I was asking was about the compensation. We don't have any type of compensation or guidelines as far as if somebody was to take over that position for a temporary amount of time. And maybe that's what's lacking. Would you guys all agree that maybe we want to take a look at that first? Would that, what are you guys thinking?
Along with that, I was wondering if there would be any reciprocity. Does Chelan Douglas need a temporary? Are we?
Right. So to me, that the compensation is a question of, would he be working under pay of Benton-Franklin Health District, or would he be working under the scope of Chelan still? So that's a different kind of an agreement.
Maybe I can clarify the intent of this. This is not necessarily like this is not a long-term duration situation. This is literally an unexpected event and we need to do a consult. So Dr. Kreger, even while on vacation, we are still operating under his license. This is, if we were going on an extended leave of some sort, we would be working with another health officer, wouldn't even necessarily be Jim Wallace. We would be consulting with you guys to say we need to find somebody for the next 3 to 6 months to be able to operate under their license. So this is a short duration situation. Where we're literally just making a phone call to say, let's say it's a TB case. Hey, we need to consult with a physician. We've got a case that's not quite clear how we need to proceed forward. Dr. Krager's on vacation. We'll call Jim Wallace and see what his guidance would be. That would be what we would use this for. So if there's language we can clarify about what this can be used for in terms of short term, that would probably help, because I don't necessarily want to turn this intention into, you know, kind of lining up a separate MOA and a separate contract for Jim Wallace. That's not the intention of this.
I think so. Basically, what you're asking for is an approved covering physician, basically for the health officer.
Yes.
I think that's how it should be, maybe titled or something, and saying, you know, that we agree that as a default, this is who the health officer identified as a replacement or as a covering health officer.
Yes.
And keep it kind of that kind of language rather than going into the, you know, extended leaves or stuff like that. So maybe clarifying the language a little bit to suit that intent.
Okay. So Dr. Krager is leaving, I think it's either the first or the second week of March. So we got a couple options. If we can call a special meeting, bring it back with the revised language, or I can take the revised language with a motion to approve it and then work with the chair on the official sign off. I just need to figure out.
Or can we make like for now at least an approval for that specific health officer for this duration that he's going to be gone, and then bring the language for
Absolutely,
next
I love
month.
that.
So we can do one.
Yep.
Good idea.
Sounds good. We'll do that.
Any other questions or comments? All right, we'll move on to for a motion to approve resolution 26-02. With the modification of when we act. Correct.
I'll move that with that amendment. Okay.
We have a motion second. All in favor signify by saying aye. Aye.
Aye.
Motion passes. Thank you all.
We'll bring that to the market.
He needs a vacation.
I know, let's not let him think it's not.
All right, we'll go on to item 6C. It says rodents. Parentheses, rat prevention work update. Jody Payton.
Yes. So I am Jody Payton. I am the manager for the land use, sewage and water section, as well as zoonotics and vector-borne diseases. So today isn't so much about what we're doing for prevention. It's just introducing the topic of rats and their public health significance. So first of all, they transmit diseases. I don't think there's any question that they transmit diseases. However, the incidence of those diseases is fairly low. The way that they transmit disease is either through direct contact, which is a bite or a scratch, such as rat bite fever, or indirect contact, which is much more common, and that is having inhalation or ingestion of urine droppings or saliva. And diseases that come to mind with that are hantavirus. And here in Washington, we have about 1 to 5 cases a year. There's also leptospirosis, which is a bacteria that is transmitted to people usually when it's floodwaters and the ground that the rats have been on has become flooded and mixed with the muddy water, and somebody's going through that water without proper safety garments. And we get about 5 cases of that every year too. There's also ticks and the fleas that live on the rats that are brought into contact with humans, like the plague. The plague is still out there. We haven't had any recent cases in Washington, but down in the Southwest, they had about 9 of them recently. Secondly, we have food safety and environmental contamination. So they can ruin our food and they eat our food. The urine, saliva, and droppings get into our food and can cause food poisoning. Mostly we hear about this when it's associated with rodents and food producing facilities. And lastly, there's the public health hazards with structural and community damages. They chew on electrical wiring, which can cause fires. They can cause structural damage. They burrow underneath the foundations and undermine and disrupt the landscaping in the area. So the problem with rats is that rats and humans, they go together and they've been together for thousands of years. And they're a mammal and they're smart and they adapt. And one mating pair can produce 1,500 offspring in a year. And that,
Say 1,500?
yes, yeah, I've seen 15,000 too, but that seems a little much. And it's just a zero. So that was a typo. I hope it was just a typo. Because 1,500 is quite enough. And so they can adapt really quickly. And the thing with the rats and the rodents, because you can't forget mice, is that they adapt very quickly. And each block that they live in, and even each building that they live in, is a completely different environment from the next building over. So what a rat wants, food and water, they want a warm place to live. And when food and shelter are abundant, they will reproduce continuously. So prevention is going to be exclusion, making sure that they are not getting into buildings, maintaining those buildings so that they can't get in, and double checking what's been done, and sanitation, cleaning it up and limiting their food sources. So here at BFHD, in the last 2 years, we've had 5 to 7 calls, 5 in 2024 and 7 in 2025. I'm not aware of any 2026. And all of these calls were usually about the neighbor's rats. They were not your personal rats. They were the neighbors. So in order to really prevent and control the rodents, we have to take an agency approach with a neighborhood. And remember that that neighborhood is its own unique environment. And so what works in one place may not work in another. And you can stay tuned for more information on that because they're not going away. And I loved the Rat Academy. So one of my favorite topics. So thank you.
Right, thank you.
May I ask, because I think I think this topic was brought in because I asked for that. And really the question was specifically what's happening on the west side in terms of combating rats, because I know, I read through posts here that it's an expanding problem, especially I can speak for Richland. It's kind of sweeping through neighborhoods. And my question during the last meeting was, do we have like a program? And the answer was not really. And I said, okay, so what has been done on the west side? Because obviously it's a problem on the west side. And
On
that's
the
really
west side, at least Seattle King County has their own rat program where they will go out and investigate complaints and offer education on prevention, the maintenance, the exclusion, and limiting the food sources, and trying to help people get them out of their personal spaces. So we don't have the money or the staff to take this on. Seattle King County has at least 2 people full-time alone in their rat program.
Any other questions or comments?
If I
Yeah,
could.
go ahead, Jeanette.
So Dr. Kawani, part of the ask here for my team when I took this back to them was to come and bring an update, since it was a new business item for us the last time that you brought forward in terms of concerns, was for us to be able to come back and talk about where we do show up in trying to educate the public. Doesn't mean that it's a robust area. And so the plan was for in March that we would put together the activities that we do here locally, because there is a fair amount of, like Jody talked about, complaints that we still do get, and education, and also an opportunity to talk about where we could be helping in the future. So that conversation is still to come in the March meeting, but unfortunately Erin is out doing some advocacy work with the Ledge for this meeting. And so Jody was coming just to do a quick recap of where we are right now. So we're not done with the conversation.
okay. Thank you.
All right, thank you. Move on to item number 6D, nitrate projects update.
Hi, my name is Emily Arredondo. I work in land use. I'm an environmental health specialist that focuses on drinking water, and I will also be presenting in person. I know that Fook, the director of the water lab, was also included in the agenda, and she will be present for any lab related questions. So next slide. So I'm here to talk about the community nitrate program.
Is it showing up?
Yes. It's showing up. Could you go to the next slide?
So an overview of the nitrate issue, Benton-Franklin Health District serves a region where groundwater is foundational to both community well-being and economic activity. And it is the primary source of drinking water for many residents. Benton County has 7,245 wells, while Franklin County has 2,938 wells. And this region also has a strong and productive agriculture economy that relies on fertilizer use. And so over time, nitrate buildup has been gradually leaching into the groundwater due to common land use activities such as fertilizer application, animal waste, stormwater runoff, decaying vegetation, and even septic systems. And so the EPA has set a limit of nitrate concentration in drinking water to be 10 milligrams per liter of nitrate nitrogen. And this is what we kind of look for when we call something safe drinking water, if anything under that level. So, next slide. And so really there is a regulatory gap and insufficient public awareness on this issue. So current regulations only require monitoring for public water system, and this leaves a gap in protection for households relying on private groundwater sources. And residents using private water source may not even know that their water has been contaminated with nitrates because it is colorless, tasteless, and odorless. And so this leaves those same people unaware of potential health risk, especially for infants and pregnant individuals. And so the lack of routine monitoring for private wells has created a significant data gap. And while BFHD is aware that nitrate contamination is an issue, the extent of impact is unclear. So next slide. So BFHD has really set out two main approaches for nitrate intervention, a short-term approach and a long-term approach. So short-term approach is advancing safe drinking water programs to address immediate needs. So this would be education, outreach, and facilitation for testing. And so this would be by supporting the Department of Health Safe Drinking Water Initiatives program, which offers free testing for Western Benton County, and then rolling out our own alternative water program, which gives free testing to all of Benton and Franklin residents. And our long-term approach includes assessing areas where policy changes could reduce nitrate exposures, and then developing analytic tools to assess nitrate exposure patterns and really support data-driven decision-making. And so another part of our long-term approach is leading a local work group to assess community resources to plan and carry out nitrate reduction efforts together. Next slide.
Do you mind if I ask one quick question? I just want to make sure you talked about free testing of wells, correct?
Mm-hmm.
Okay.
Correct. So this talks a little bit more into that. So short-term intervention, free testing program. So BFHD is offering free nitrate testing through the alternative water program to all Benton and Franklin County residents for screening and public health purposes. And we are specifically focused on raw well water, meaning water that is before any sort of filter, just to make sure that we're actually accurately capturing the quality of the water. And with this program, income eligible residents may also receive a portable reverse osmosis system at no cost if they do exceed those 10 milligrams per liter with their results. And the program was already existing in 2025. However, it was limited to just programs within partnership programs within Benton-Franklin Health District and then other selected participants. But now this is available to all residents within Benton-Franklin. And then the Benton-Franklin Health District is also supporting the Washington Department of Health Safe Drinking Water Initiatives programs, which that one also offers free testing on the portion of Western Benton County. So if anybody is interested in knowing what program they qualify for, they can call our environmental health desk and we can get that figured out for them. Both of them would be free of cost. Next slide. And so really this leads into our long-term intervention. All the data collected through our free testing program, including DOH free testing programs, will be added onto the Benton-Franklin nitrate data map. And this would help us support data-driven policy decisions, direct local partners to community needs, and then raise awareness about nitrates and safe drinking water to the public. And for this portion of the long-term intervention, I'll invite Amy Person to kind of give an overview of our nitrate map and give a little detailed explanation of what is and what will be of this.
Thank you. I'm Amy Person. I am one of the epidemiologists here at Benton-Franklin Health District, and I believe they're going to bring map up. So the nitrate map is available to the public on our data dashboard page. So here it is. We've got sort of red, yellow, and green dots, and the red dots indicate wells that have been tested that are that exceed that 10 milligrams per liter level. And then the yellow ones are ones that have elevated levels that haven't reached that, and the green do not have that. So this is really an example of us working towards data modernization. So taking information that we have, years and years of information about nitrates and about wells and about land, and making it more accessible, more usable, and more flexible. So sort of phase one is really raise public awareness. So anyone can go and check, if they want to look at areas where they seem to see a lot of red dots, they can click on any one of those and it will show them when that was tested, what the levels were. They can put in their own address if they want to see, do I live in an area that is close to where we see a lot of elevated nitrates? So again, this allows individuals to make decisions about, am I concerned about the water? The next phase is really going to be, how can we use this information to tell us what we can do at a community or a policy level. So we're going to be looking at not just all of the testing data we have, but we have data from well logs. So we have information about wells and how deep they are, how old they are. This is going to allow us to be able to, over time, combine this with information from our other departments to understand how do decisions that we make about septic systems, about wells, about where we put things or don't put things can change kind of the landscape, and also to sort of guide how we can be most effective in our interventions. Do we want to look at areas where we see a lot of red dots? Because obviously there is a lot of high nitrate levels. But I'll also say we can be thinking about, we have areas sort of in the more rural ones where we might only see a couple red dots. Now, does that mean there's limited concerns about nitrates, or is it just we have a lot of people who are not testing? So do we need to be thinking about how can we raise awareness that there is nitrate in areas here, and here's an opportunity if you are a well owner and you've never gotten your well tested, if you're concerned about the finances of it, at least through these programs we have right now, an opportunity to get tested. So again, this is really going to allow us to really help make our public health data more public. So it's not just numbers written on papers in the lab, papers in the land use department, even papers in communicable diseases, but we'll have more central areas where we can share that information. So there will be a lot more to come on that. Thank you.
We have a couple of questions. Go
I do
ahead.
have a question. Nice to see you, Dr. Person. So I am ignorant on what does nitrate do to the body, and then what dangers or how could somebody detect if they are sensing something in their body? Is there any indicator, or does it just happen to you and all of a sudden, you're sick,
Well, the primary, I would say historically, one of the biggest concerns around nitrates has actually had to do with newborns. So, they have those kind of blue baby syndrome that are related to that. So I think that's really where it initially came to be a concern. I think excessive levels of nitrate can have other effects on the body, but I will say it's not something where like you could go to your doctor and say, check my nitrate levels to tell whether or not I have a problem. I think it's tends to be more if you have chronic health conditions and you are exposed to excessive levels of nitrate, that can kind of make those things worse.
Okay.
And on that note too, I will just say in general, I think this is really a sort of up and coming area, not just in public health, but in medicine as well, to be looking at what are those environmental health impacts that are going to be causing problems for us in the future. So yeah, there's not a great way to know if you yourself have experienced effects from nitrate. So a lot of it is you can be safest if you're in an area where nitrates have been found in the water, and you have a well, get it tested to see so that and particularly if you have underlying health conditions, you are going to be at higher risk.
Any other questions?
Yeah, I do have a quick comment and actually a question. So the comment back regarding the symptoms, mostly as Dr. Person had mentioned, mostly in pregnant women and kids. There's a condition called blue baby syndrome related to basically hemolysis of red blood cells. Same thing with adults. It can lead to chronic anemia, non-specific symptoms like fatigue. There's a mixed data about role of nitrates and cancer risk, specifically thyroid cancer risk. But again, the data is not as robust, but mostly in kids and pregnant women. But I guess my question to Dr. Person, for people who use well, do we have mandatory testing or this is optional? And should it be mandatory if it's not?
Oh,
I'm gonna put that to our persons in the water program. I'm more than.
Yeah, I'd go back to the podium.
So for private wells, there's just DOH has what is, and so does VFHD, what is encouraged testing, which is nitrate and coliform testing once yearly. However, upon doing the outreach event and even just looking at the general data we get to the lab, we see that a lot of private well owners that have been, say, living at their house for 30 years on a well have no clue that they have to test. So the answer is no. There's no authority, no state regulator that requires them to test. This would only be for shared wells. That would be Group B wells that are considered public water systems, and Group A, which are like larger community systems.
I do have just a comment. I've been in the lending business for 30 long time, but seen it all. But I can tell you when home buyers go in and buy a home that has a private well, and they do a well test, the homeowner doesn't even know if there's high nitrates. They're actually surprised.
Yeah.
And then it creates a lot of back and forth. Who's going to fix it? How to fix it? Those whole 9 yards. So I encourage, if you ever want to come to one of our Benton County Commission meetings, just to kind of give a overview and show that map, that would be great. The other thing I would maybe recommend, because I think we have over 1,000, there's over 1,000 real estate agents here in Tri-Cities. And sometimes they'll do a membership meeting where they'll have, several hundred people there. And maybe that would be a good topic to ask them to come in. I think they would do that. And then you could show that map and make awareness of all those real estate agents going, hey, look at these maps. Did you know this was available too? I can tell you the majority do not know that. And that'll be a little bit more proactive. That's a way to get some more of that education out. Just some food for thought.
Yeah, it's definitely good. I think one of the things I also want to clarify that if someone does find nitrates in their water, there are filters that do take that out. So don't think that because there's a home in an area of high nitrates, it's doomed. It's just for the purchaser to be aware that there are certain filters that might need to be installed at the point source, like full house filtration, that can be costly. Or there's always like alternative water bottles or having like the gallons. So there's always those options. What we really want to focus on is awareness, because yes, you know, that is an option, but people don't sometimes don't know that they are drinking these nitrates. And then one of the features on our maps is that the zoom is limited. So we want to focus on the public being aware of the affected areas. There are no addresses that are made public, and after you zoom in to a certain point, it all goes blank. Just because we more or less are focused on the people that are affected presently, not necessarily real estate. You know, we don't want filter companies going after, you know, these homes and door to door knocking.
But I would think still for education, if you, it says, if you ever want to come down and make it more public and educate during one of our county commissioner meetings, I can make that happen. And like I said, going there just to educate real estate agents, because they are out in the community quite a bit, not necessarily for purchasing homes, but just for being more proactive and letting sellers and buyers know. The more people that know about this, to be more proactive, the better it is for both counties. So just being more educational, I think, would be a way to reach out to them. And if you need help on that, let me know.
Okay,
And I'd like to add to Commissioner Alvarez's comments is that Rotary, one of the focuses for Rotary is clean water. And I think that you would find a lot of Rotarians very interested in this subject. So if you want to come to my Rotary class.
Yeah.
Options.
And one quick comment. I mean, there's a lot of commercial filters that actually easy to DIY. Pretty much takes you 3 minutes, 4 minutes to install under the sink that you're gonna use for water to drink. It takes a lot of organic chemicals out as well as nitrates, and it's not super expensive. It's, you know, average about $150 a year to change one of those, and you can do it at home. You don't have to do it for the whole house. You're doing it basically for drinking water.
Yeah, very nice.
Yeah.
All right, thank you very much. We'll move on to 6E, Code Red, Crisis 24 presentation. And Eli, if you would state your name for the record.
I will. Yeah, I'm Eli. I'm the emergency preparedness supervisor. I know you had appreciated us, you know, earlier for being in this meeting. Just appreciate everybody else in here as well. Appreciate the board. Yeah, so we'll go and get to the presentation. I do have some slides as well that were shared for this presentation. And we've been working on a Code Red advertising campaign for the last few months. And so, yeah, I'll talk about that a little bit. Let's go to the next slide. And to start out, I'll just go and kind of work this in reverse a little bit, because we have some of those products available now. And so we'll listen to one of the radio ads that came about from this process. So if you'd click that speaker icon, that'd be great.
For the people you love, being all in isn't optional. Because when people count on you, you show up every time. But when disaster hits, you can't protect the people you love if you are the last to know. Code Red is a free emergency alert service that sends real-time evacuation or shelter-in-place instructions from local officials to your phone. It's fast, reliable, and made for people like you, the ones others count on. Sign up today at bfhd.wa.gov/allin.
And so that was one of the radio ad components, and we'll watch some of the video components as well later on in this presentation. I think my goal is mostly to listen to stuff, and then I'll talk a little bit. And so what is Code Red, though? First of all, we heard about it a little bit in that radio ad, but it's a emergency notification system. It is for community safety. And one thing that sets it apart from other notification systems that you might get from the state or from other, Amber alerts or things like that, is that this notification can be geo-targeted. So instead of notifying all of, let's say all of Richland that they need to evacuate for this flood, you can notify specific neighborhoods about this flood. But one of the challenges with this system is that this is a system that you do need to opt in order to get these notifications, these alerts that are geo-targeted. And so that's why we put together this advertising campaign. We noticed in some of our events, like the Lineage Fire, that we just didn't have the coverage in the system that we would have wanted. And again, these notifications actually come from both of the counties, so Benton County Emergency Services and Franklin County Emergency Management. So that they sent off these notifications, and that was one of the gaps we recognized from that Lineage Fire. And then also, again, as we had these flooding impacts just recently as well, is that, you know, we needed these notification systems to spread out a little bit more. Yeah, let's go ahead and go to the next slide, Maya.
It's Lauren that's running them.
Oh, Lauren. Right. There's Lauren from the background. So yeah, in this process, I already mentioned it a little bit, but we worked with Benton County and Benton County Emergency Services and Franklin County Emergency Management throughout this process as kind of, you know, we were kind of the technical expertise for developing this, providing the knowledge that was necessary. And then we worked with a company called Brandcraft to put together the video advertisements, as well as the radio announcements as well. And then obviously the background, the one that hosts the actual services, is Code Red. So this was just a good partner collaboration. If you would click the button a few times, Lauren, got just a couple images on there. So go back one. So I made it too complicated, I think. And then, yeah, so those images on there on that screen are just messages that have come from public health that have been posted onto each of the county emergency services websites. And so we already have that collaboration in place. So this was a natural extension for us to be able to work with them to help them out with their systems so that our public health messaging and their messaging as well can go to a greater population within our cities. All right, we'll go ahead and go on to the next slide. And now we're getting into some of those videos that were produced because of this advertising campaign. There's one of them that we'll watch in English, which is the left one, and then we'll watch the one on the right, which is in Spanish.
When emergency sparks, if you're not in the know, you're not in position to protect yourself and your loved ones.
Can we make that bigger, Lauren?
Your kids, your parents.
Sorry, what?
Can we make that video bigger as you play it?
It's embedded. I don't think so. That's as big.
When emergency spark.
Oh, Carl's yet.
We're also having an audio issue where that is not playing for any of the participants.
Oh, okay. We can hold on for a minute if we can figure it out.
I have computer sound shared.
I think when you're talking, Eli, about BCES, I'm the co-chair on that and a board member on there as well. And that role is only going to get more robust as we go. We start putting more infrastructure in there with all the microwave towers and stuff. So if you ever need any more help on that, just let me know. I'll be glad to go ahead and help anything that we can do to get this out. Awesome.
Brandcraft's also been helping us with things like that.
Oh, good.
They're really great. Who's on the board or the chair for the chamber.
Okay. We're working this.
We are. You're already giving some great ideas.
If you're not
Communications person.
Yes.
And for your kids, your parents, those who look up to you for answers, guessing isn't good enough. But you don't have to panic. You just have to prepare. Code Red is a free emergency alert system that gives you real-time official notifications from local authorities during disasters that require protective actions like sheltering in place or evacuating. So if you're all in for your loved ones, be in the know too. Sign up today at bfhd.wa.gov/all-in.
Yeah, the video definitely makes it a little more powerful as you watch it. But yeah,
I can help set it out.
What?
I can help set it
Yeah,
out.
if you want to just send them out afterwards, that'd be great. Let's go and listen to the Spanish one now. And we'll just keep the screen small on this one too. And then we'll have answer any questions here at the end. I know people online might not be able to hear it, but we'll just share it out afterwards.
Algunas personas esperan hasta que lo ven en las noticias, hasta que ven humo en el cielo, hasta que alguien toca su puerta. Pero usted no es así, porque sabe quién confía en ti, tus padres, hijos, abuelos y vecinos, y no pones en riesgo su seguridad. Code Red es un sistema gratuito de alertas de emergencia que utiliza las autoridades locales para enviar información en tiempo real sobre evacuaciones y refugios durante incendios forestales y otros desastres en su zona específica. Cuando está informado, no tiene por qué alarmarse.
Thank you. That's really the crux of the video. You know, there's a lot of people in our communities that, you know, may not get this notification because they may not sign up. You know, if you're elderly or if you have different reasons to, you know, just not be part of that system, that messaging is essentially saying, like, you can be the one to sign up and inform those people. And so I think Brandcraft did a really good job, you know, putting this together, and creating that, you know, powerful messaging. Okay, so we're going to go to the next slide. And again, we'll send out these videos for those that could not hear those. So yeah, now we're at we kind of went through the process of getting that advertising material together. And so now we are in just the process of rolling it out, you know, and creating those plans to implement that. And so I think, so we'll continue to work with Brandcraft for that as far as that implementation piece. And then, yeah, we'll work with both Benton and Franklin counties as far as, you know, filling in gaps or filling in additional pieces that we can add to those advertising campaigns. You know, things like, you know, possibly getting this into schools as well, and then getting take-home material that can go to parents and things like that. So we'll continue to work on that process. In the meantime, this is live, so people can go to bfhd.wa.gov/all-in. They can go to that landing page, which will allow them to sign up for Code Red and, you know, be informed. And that was the last slide. Just let me know if you have any questions.
Any questions or comments? Seeing none. Oh, just a quick question. Did Chief Huntington, I don't know if you know Chief Huntington, is a fire chief over there in Richland. Was he part of, did he have a lot to do with this or part of that? Do you know?
Not too much. We mostly just worked with the emergency managers on each side.
So on the other side, we have, sorry, Eli, we have quarterly PIO meetings. And so we're actually hosting the March meeting here. And that's with all the emergency management throughout the area and also the regions. Sometimes we get Walla Walla, Yakima, and Grant County that come. And so we've just been kind of letting them know what's going on. And so as Eli's team has been coordinating, we'll continue to get that through the cities too. And then fire and police. So it's just kind of the initial steps, but we're definitely going to continue to move forward, and Eli and his team's done a great job. So
I do have a quick question. I mean, obviously, this is a very important program. So why is it that this is not like by default that you get informed and you only choose to opt out? Like, for example, some, you know, and there's data behind why this is important. Like, for example, countries that have by default, like you're, for say, for example, a kidney donor or a donor in general, and then you can opt out, have much higher transplant rates than countries that do it the opposite, where you elect to choose to be a donor. And I think this program seems to be so important that if legally possible, and if this is not something that is prohibited by law, it should be, the default should be that you should be notified about an emergency in your neighborhood. And then if you choose not to be informed, you can always opt out. Just a question.
That is a good question. I'm not sure if I know the answer to it, other than I know that the system itself is just set up that way. So the system of Code Red in general throughout the U.S. is just set up as an opt-in system.
All right. Well, I think we're good. Thank you very much for the presentation. All right, we're gonna move to item number 7, announcements, if any.
There we go.
Great timing.
Seeing none, we'll go to an executive session discussion with legal counsel about current and potential litigation for RCW 42.30.110I1I.
Yeah.
All right, moving on. So do we have that gentleman?
Yeah, I don't think Chris is on with us today. Can we just do a quick double check on the participants? Cannot meet in that session without him. I do not see him, so we can skip to
Let's
next
skip that
March.
We'll go to item number 9, approval of vouchers. Do I have a motion to approve the vouchers for 3-2026 to 11-2026? And the amount of $1,080,082.94.
I
You just make the motion?
I was gonna say.
I mean, you want all the work.
I know, but you know what? I made it easy.
You just want to show up your.
Move to take the, as mentioned.
I'll second the motion.
There we got a motion, second. All in favor signify by saying aye. Aye, motion passes.
They'll clean it up in a minute.
That'll work. All right. Before I go to item 10, do I have any board members that have any comments, any ideas, any questions, or anything that could address the staff or anything else? We just go down the road. You're looking at me.
You fishing for, no, I'm very impressed with the staff. It's, been 3 to 4 years now, and you guys are rocking it, so.
Exactly. Always heard good, you guys are always in the news for good things lately, so let's keep it that. Keep me out of the paper.
So, and I didn't speak up when Jody was talking, but has the Tri-City Herald run an article about the rat situation, things people can do? Because I read it, but I don't scrutinize it. I may have missed one.
Mid-September, I
Okay.
was interviewed by the Tri-City Herald and they put out an article.
Thank you.
And then I think in early October as well, there was an article about rats. So they quoted me. I don't know if that's what I said, but they quoted me.
Thank you.
And any board members online that would have any comments?
I actually had a question for Commissioner Mullen if he's still on.
And it sounds like Janae has a question for Commissioner Mullen if he's still on.
I do not see him online.
Okay. Looks like we're,
Commissioner Alvarez, I'll just
Yes.
again announce that the nominations are still open for Tri-City of the Year. So if you know of somebody that has done outstanding service above self in our community, you can find the nomination online at tricityoftheyear.com.
perfect. Well, thank you. All right, with that, we'll go to item number 10. Date of next meeting is March 18th, 2026. And thank you all for attending, and the meeting is adjourned.